Okay, this is Dr. John Wyckoff, and welcome to another exciting podcast on Pathway to Wellness with Dr. John Wyckoff. I'm the founder and CEO of Wyckoff Wellness in East Lansing, and today we have a very special guest, a person that I'm proud to consider a colleague. He's an author, a mentor, and most importantly, a very good friend, Dr. Stephen Hotze. Welcome, Dr. Hotze.
John, Dr. Wyckoff, thanks so much for having me today. It's great to be with you.
Well, it is a privilege to say the least, and you and I go way back. We have been involved professionally and personally. I was thinking about this morning since around 1990. It's been 25 plus years, and really hard to imagine it's been that many years. But Dr. Hotze is the founder and I believe CEO of the Hotze Health and Wellness Center in Katy, Texas. The Hotze Health and Wellness Center is very similar to the Wyckoff Wellness Center in East Lansing, is that we're committed to empowering patients to take charge of their health and to find solutions for chronic health problems. And we're going to try to do that with an emphasis on natural ways. And, I thought we'd lead off, Steve, by just talking about people that have chronic disease. They get so frustrated when they go to their conventional MD or DO because the typical approach is, well, we have a diagnosis and we have a name for that, and let's put you on a medication. And if one medication doesn't work, well, we got 2 or 3 medications. And, there's a pill for every ill, but seldom do they talk about other ways to look at the illness and support health and wellness naturally. And tell me a little bit about your approach at Hotze Health and Wellness Center and how you help people with chronic disease get on a pathway to wellness.
Well, first, it really started when I graduated from med school. I went to the University of Texas here in Houston, Texas. Graduated in 1976, so it's almost been 50 years. I've been licensed as a physician. And my dad had a banquet for me on July 31st, 1976, when I graduated, and had family members there and friends, and it was a big deal, of course. I'm the oldest of 7 boys, so they wanted to throw a nice banquet for me, and they did. And over dinner, Dad turned to me and said, "Son," I said, "Yes, sir." He said, "Son, don't poison your patients like all the other doctors do. Do you understand me?" It was not a request. It wasn't even a recommendation. It was a command. Don't poison your patients like all the other doctors do. Now, my dad was an entrepreneur. He had a large manufacturing company in the oil and gas pipeline industry, which we as a family still run Compressor Engineering Corporation. But Dad was a wise man, and he knew that drugs could poison you. And as a matter of fact, all drugs are toxic. They have an LD50, which is the lethal dose at which 50% of the people will die if they take it. So drugs are toxins. Why do I say they're toxins? A toxin's a poison. Why would I call any pharmaceutical drug a toxin? The definition of toxin is poison. Your body had the first course I took in medical school, my first year, was pharmacology. And the first chapter was detoxification of pharmaceutical drugs. The liver has to detoxify, get the poison out of your body. And so drugs are toxins, and nobody is sick because they have low levels of pharmaceutical drugs, toxins in their body. People become ill for several different reasons. One is they become, let's say, more debilitated, or their energy level falls. They are not as healthy as they used to be. And that is just the aging process. 18-year-olds are going to be a whole lot more vibrant than a 60 or 78-year-old. That's just part of it. But what causes that? Well, one of the major causes of health problems in the United States is one, I think most importantly, is absolutely poor diet, poor nutrition, eating junk food. You can't be any healthier than what you eat. If you put junk in your body's going to be junk. And if you look at the population, Over 70% of the population is overweight, over 40% are obese, and that causes a host of health problems, from coronary artery disease to type 2 diabetes, which leads to kidney disorders. And next thing you know, you're throwing on a bunch of drugs and your liver enzymes are out of balance, and you're just getting sick. And you're sick and tired of being sick and tired. So your eating program is really critical to regaining your health. The second thing, as we age, inevitably, our thyroid hormones, which come from the thyroid gland in the neck, which is shaped like a butterfly, the thyroid gland produces thyroid hormones. And there are two specific thyroid hormones that are produced by the thyroid gland. T4. Look at my hand. This is the thyroid molecule, and they call it T4 because 4 iodine atoms are hooked up to the thyroid hormone. 94 to 95% of the thyroid produced by the thyroid gland is T4. T4 is inactive. It's not the active thyroid hormone. The active thyroid hormone is T3, of which your body makes about 5 or 6% of T3. T3 has 3 iodine atoms. So why do we make T4? Well, T4 is made and it is secreted into the blood. It doesn't do anything in the blood. I don't care what your blood levels are in your thyroid. You can have normal thyroid blood levels and still be clinically hypothyroid. The T4 has to enter the cells, and in your cells, there's an enzyme called deiodinase. It deiodinases T4 and converts it to T3, which is the active thyroid hormone. And think of your thyroid hormone as a spark plug in your cell. Your cells have a power plant called the mitochondria. Every cell has this. You've got trillions of cells. That mitochondria produces electrical energy that then drives all the biochemical reactions in your body so you're healthy. What happens is we age, we oftentimes, and there are other hormones affecting this, the sex hormones affect this as well, your thyroid level begins to decline. You don't get enough T3 into the cells. You're operating on T4, which has very poor activity, and your voltage goes down. You're not making enough electricity, and that affects every organ in your body, your brain, your skin, your heart, your liver, kidney, your entire your bowel function. All this is affected by thyroid. And so if your thyroid levels begin to decline, guess what? Your energy levels could decline. Now, you'll go to your doctor and you may read up on a low thyroid situation, which is called hypo or low thyroid. And you look at the symptoms of that. Well, it's very commonly, it's fatigue, energy level declines. Oftentimes, the individuals will have cold hands, cold feet, cold sensitivity. They'll have dry skin. They'll have joint and muscle aches and pains. They don't heal well. They tend to get more infections because their immune system needs energy too. And if you have an immune system that has low voltage, it's not going to be as effective in fighting off any bacteria or viruses or fungus that come into your body. And you may have sluggish bowel function. These are some classical symptoms that we see with low thyroid, and people often present with this when they get into their late 30s and 40s, commonly because the imbalance in female hormones adversely affects the ability to utilize thyroid hormone. Women get what we call estrogen dominance, which causes the liver to produce thyroid binding globulin, which binds the thyroid hormone. They don't get it into their cells as well. They're not making enough progesterone. They're not ovulating. Once they get past 40, they have anovulatory cycles, which means they don't ovulate every month. And when a woman ovulates, she makes progesterone to balance the estrogen, which is stimulating the production of the inner lining of the uterus. So when the female hormones become imbalanced and decline, it causes the liver to produce thyroid binding globulin, which binds onto the thyroid. When men's testosterone levels decline, testosterone enables the cells to convert T4 to T3. And if you don't make enough testosterone, and you don't, as men age, their testosterone levels decline. So we have declining sex hormones, and that adversely affects the thyroid. The thyroid itself isn't going to be as productive as you age. So what you end up is you end up being low voltage, and you feel sick and tired. So you go see your doctor. What does he do? Well, let's run a blood test. You go, doctor, I read about thyroid. I think I might be low thyroid. Oh, you're not low thyroid. Well, I'll prove it to you. Let's get a blood test. And he comes back and says, your thyroid's in the normal range. Well, what does that mean? This is how the lab determines what the normal range is. They take the last 1,000 or 10,000 blood tests and they measure the thyroid in all those tests and they get an average. It's called the mean. And it's a bell-shaped curve. The mean would be right in the middle. The bell-shaped curve is like this from high to low. So when you have the mean, they add 2 standard deviations, a statistical term, and that encompasses about 95% of the population. So the range can be as tall as the Empire State Building, as wide as the Grand Canyon. So if when you were younger, your thyroid level was up at an optimal level, and now it declines by 50%. It's still within the normal range your doctor tells you. It's normal. But now you got 50% less thyroid than you had when you were young and vibrant. Well, guess what? Your energy level is going to decline. You're not going to be making the electricity within your cells that drives the biochemical reactions, and this has an adverse effect on your overall health. So you go to the doctor, he says, everything's normal, but I think you're depressed. He puts you on an SSRI antidepressant. Or he says, your cholesterol is a little high. I'm going to put you on a statin drug. And your joints hurt, I'll put you on some anti-arthritic drug. You got some stomach problems, I'll put you on some Nexium. And one thing you know, you're on one drug after, and then your blood pressure may be elevated because you've gained weight. That's very common in low thyroid individuals, weight gain. Not everybody that's low thyroid is overweight. It's a common feature of being low thyroid. We do see individuals that have a failure to thrive and they're very thin and they can be low thyroid. And thyroid, by taking thyroid, interestingly enough, you'd think intuitively if you took thyroid, you wouldn't be able to gain weight. But in those individuals that fail to thrive and they're not able to gain weight, sometimes thyroid will turn them around, they'll be able to get back to a normal body weight. So that's the overall view of the aging process is, 1, we don't eat healthy. 2, our thyroid hormones begin to decline and we don't get enough into the cell. And this is what we call clinical hypothyroidism. So in our practice, Dr. Wyckoff, when people have symptoms of low thyroid, despite the fact that they may fall within a wide range of normal, we still add a little bit of thyroid, trying to get their thyroid levels back to a more optimal level. Not within the normal range. We keep it within the normal range, but we optimize the thyroid and we balance out the hormones, female hormones, and also male hormones. So we use clomiphene, which stimulates the testicles naturally to produce testosterone, or we take testosterone cream or testosterone injections in males to help get their testosterone levels up. In females, we balance out their hormones primarily initially while they're premenopausal, which happens at approximately 50 years of age, can be later or earlier. But when women start having the symptoms of hormonal imbalances, it's usually due to low levels of progesterone. So we add progesterone. And what are the symptoms that women have when they have estrogen dominance? Remember, estrogen, when a woman has a cycle, when she has her menstrual period, her hormones have stopped. She sloughs the inner lining of the womb, and then she begins to make estrogen for the next cycle. And that estrogen promotes and stimulates the inner lining of the uterus to grow and to beef up. And then when she ovulates on day 15, in a perfect rule, you have a 28-day cycle. So on day 14 or 15, she'll ovulate. And when she ovulates, the area where the egg comes from is called the corpus luteum. That makes progesterone, which matures the inner lining of the womb, preparing for a pregnancy. as women move through their menstrual life, and it's very commonly after they have children, their ovaries have been shut off during the pregnancy, and oftentimes they don't come back in full steam like they did before when they were younger. So they have low levels of progesterone, and they have higher levels of estrogen compared to progesterone. It's called estrogen dominance. That proliferates the inner lining of the womb. And so they go from having a 3 to 5 day cycle to a 5 to 7 day, a 7 day to 9 cycle. They get heavier bleeding, cramping, they get mood swings, fluid retention, weight gain, breast tenderness, migraine headaches premenstrually. And this comes on as they mature, and that's a sign of low progesterone. And then oftentimes when this happens, and then they get breakthrough bleeding, so they go see the obstetrician, and the obstetrician or the gynecologist, they see their obstetrician gynecologist, he goes, well, we can solve that problem real easy. We'll just do a hysterectomy. So they do a hysterectomy, but that hasn't solved the underlying problem of the hormonal imbalance. So while it stops the irregular bleeding, they still have this hormonal imbalance, and within 2 years, their ovaries will shut down usually, and they'll go into early menopause, surgical menopause at that point. If they haven't taken out the ovaries, that's true surgical menopause. So sometimes the gynecologist will just remove the uterus and leave the ovaries in. Other times they'll take them all. So total hysterectomy would be when they take the ovaries, the fallopian tubes, and the uterus out. And when that happens, and they often put them on some counterfeit hormone like Premarin or Primpro. That's been shown to cause a host of health problems, and women feel terrible on that. We use in our practice, Dr. Wyckoff, bioidentical hormones, the hormones that are identical to the hormones that your body made previously in adequate amounts. These are derived from plants. They're changed chemically in a lab to be biologically identical. So your body doesn't know that it's coming from a lab. It thinks it's getting it from your own body. So that's what we use is bioidentical hormones. And then on top of that, we always use vitamin and mineral supplementation and a nutritionally balanced eating program. I might mention one last thing is that the microbiome, your gut bacteria, and this is a bacteria in the colon, there's good, healthy, autochthonous bacteria that enables your body to function properly. They even make vitamins. But when people take antibiotics, it will oftentimes wipe out the normal healthy bacteria. You get yeast overgrowth. Women oftentimes will get female yeast infections, and you can clear that up, but you still have yeast in the colon, and that produces leaky gut syndrome, and you get a lot of toxins that enter the bloodstream and leads to autoimmune disease and a whole host of problems. So what we try to do with our guests is we put them on a yeast-free eating program. Yeast grows on sugar, so we eliminate sugar. We go on a ketogenic eating program. We give them nystatin to kill it in the spore form, and we give fluconazole to kill it in the wall of the intestine. And we clean up the bowel, and they give probiotics and trying to get the gut microbiome healthy again. You got to have a healthy gut in order to be healthy. So that's another major area that we address. So that's basically the warp and woof of our practice. We also do airborne and food allergies. We treat for that, and you and I were in the Pan American Allergy Society, and I know you do the same thing. We treat with sublingual drops, and we use low-dose immunotherapy for our allergy treatment, and we treat for yeast, we treat for natural thyroid hormones, female hormones. We address adrenal fatigue. That's the adrenal gland, which becomes overloaded when you have chronic health problems. When you have chronic pain, you've got chronic allergies, stress in your life, all these will stress the adrenal gland. And so we'll oftentimes, in individuals, when it's indicated, we use a little bit of natural cortisol to supplement the adrenal gland to help it get back and take the pressure off of it. And then we use vitamin and mineral supplementation, exercise program, and a good nutritionally balanced eating program, which is primarily a ketogenic eating program. We eliminate the carbs, the simple carbs, sugar, wheat, corn, potatoes, rice, that quickly convert to sugar because yeast grows on sugar. And sugar also, when you get sugar elevated in your body, it gets converted to fat. And it also causes insulin resistance, so it can cause a host of health problems. So we encourage good, healthy meats and salads and green vegetables is what we recommend. And if you can eat organically, all the better, particularly in your meats. They're starting to shoot up all these animals now with the mRNA vaccine, and only God knows what kind of health problems that's going to cause. So we personally, I have a place out in the country. We grow our own cattle, and we slaughter them, and nothing's fertilized. They eat grass. They don't get vaccinated, and we slaughter them at about a year and 2 months. And so that's safe, and I feel very safe with that. We also have chickens out there too. John, you may not believe we got 80 chickens, and we get 12, 14 dozens of eggs every week, and they range feed right out on the range. They also get ate by the hawks too. So we're constantly having to take the eggs, put them in the incubator, and grow new chickens. We're feeding the hawks. Well, that's the long and the short.
Yeah, I think that's such an important aspect that people they lose track of the fact of what they put in their body is what they're going to get out of their body. So eating organic fruits and vegetables, organic meats, getting away from pesticides, herbicides, synthetic hormones in the food supply is so critical. And I understand it takes more time, it takes more effort by the consumer. But if you don't get those basic things in place, you don't give your body a chance to get healthy. And in the area that we've been exploring more and more at Wyckoff Wellness has been this, you've touched on this idea of how do you convert an inactive hormone like T4 to T3 efficiently? And you're right, this really does involve a process that we call methylation. And I don't know if you're familiar at all with that, Steve, but methylation is genetically driven by a handful of methylation genes, 5 or 6. You can measure those, and you can support those with methylated multivitamins, with methylated B9, methylated folic acid. You know, folic acid is something that's not part of our diet. It's a synthetic chemical that's put on the grains by government mandate. So you need to get around the folic acid, and you're right, eating a ketogenic diet, getting off the grains, but then supporting your body's ability to methylate will improve its ability to convert T4 to T3, to metabolize the female and male sex hormones adequately, to metabolize cortisol adequately, to reduce your levels of neurotransmitters that are stimulatory, which can affect sleep. So, you know, the supplementation aspect of what we do, and I know the supplements that you have available at Hotze Health and Wellness Center contain the methylated form of folic acid and the methylated form of B12. Those are critical for optimal health and wellness. Without those basic building blocks, you're at such a barrier or a deficit to get healthy, let alone going the next step and saying, okay, we need to add some thyroid hormone, we need to support your sex hormones, we need to support your adrenal hormones. People need to appreciate the fact that they've got to build that foundation before they move to that next step.
Listen, let me mention one other thing about the thyroid hormone and the conversion of T4 with 4 iodine atoms on the thyroid hormone to T3. The enzyme inside your cell that converts T4 to T3 is the deiodinase enzyme. It deiodinates it. And when you have fluoride in your system, fluoride poisons that enzyme. And 70% of the public utility water that people drink in America has fluoride placed in the water. We recommend reverse osmosis or some kind of filtering system that you can filter out the fluoride and even the chlorine and other chemicals. I mean, the public water has tons of different chemicals in it as well. You're poisoning your body. But fluoride is very dangerous, and we have it in our toothpaste. But if you look on the side, you pull out your Crest toothpaste or any one of the toothpaste that people normally purchase, and there's a little box that says warning. It says, if you ingest more than just a toothbrush full of this, contact poison control or go to the emergency room immediately. Now, why would you have a warning like that why would you have anything in toothpaste that would cause you to have to call poison control? What is it? It's fluoride. The non-fluoridated toothpaste like Spry, and there are a bunch of others you can find at the store that don't have fluoride in them, have no warning.
No,
So
it's a great point.
One thing you have to do is get rid of the fluoride in your water and get rid of it in your toothpaste, and don't let your dentist paint your teeth with fluoride.
I think that part of the reason is people get older, and you're right, people start to have these symptoms. Oftentimes they're very insidious in their onset, the fatigue, the brain fog, the slow weight gain, the trouble sleeping. They don't appreciate that this process of toxicity is cumulative. It builds up over a lifetime. And certain people have the genetic ability to detoxify better than others. We all know those people in our lives that seem to eat and drink whatever they want and they stay healthy. But the majority of people, probably 85% of the population, has got some genetic defect in methylation, and this toxicity is building up day after day, year after year, and slowly it slows down our ability to make active thyroid hormone, to activate our sex hormones and our adrenal hormones. And we have these symptoms that your conventional doctor is going to do a blood panel, a CBC, a TSH, and it's just not going to be able to get the answer you need. So you've got to find someone that's involved with functional medicine, like Dr. Hotze or myself, Dr. Wyckoff, to look at things differently. Both Dr. Hotze and I have a larger tool chest, a larger toolbox, and we can find the right tests to help you get on that path to wellness naturally. That's what we're all about at the Wyckoff Wellness Center, and I know that's what you're involved with at the Hotze Health and Wellness Center.
Right. We have very, very similar practices in our approach to medicine. We're mavericks, okay? We think out of the box. We didn't, and my dad was a maverick. You know, entrepreneurs tend to be mavericks, people that set up their own practice. All these other doctors, conventional doctors, now more and more working for hospitals, and the hospital they basically work for the insurance companies. Again, an HMO, PPO, and they're not allowed to do natural approaches to health. They have to follow the protocols of the insurance company and or the hospital, no matter whether they believe in it or not. So most of these doctors, because their income is based upon their insurance companies' payments or on the hospital, they're hired by the hospital more and more. And you're probably seeing this up in Michigan. Doctors are working for hospitals now, and the hospitals are calling all the shots. So you want to have a doctor that's independent, who takes cash for the services rendered. This is the way it was done in the old days. You know, it's a novel idea. Pay me for my services when I render them. You do that for the air conditioner. You do that for your car services. You know, when somebody provides a service, whether they mow your yard, you don't put it on an insurance card. You pay cash. So for general maintenance, I'm not talking about if you get hit by a car or have a massive heart attack or you need surgery for a broken arm or something. Of course, conventional medicine for those type of injuries and those type of problems is wonderful in America. But it's the conventional doctors that are treating with drugs, and they're not the surgeons. And by the way, I have a surgery background, so surgeons and internal medicine doctors are kind of at war with one another. We always frown down on them, and they frowned on us. That's just the way it is. In fact, John, when I did my surgery rotation, I'll never forget one of the surgeons said, "A chance to cut, doctor, is a chance to cure."
That's right.
And that's the way surgeons approach life. They got a chance to cut, a chance to cure. Now, listen, let me mention something to you, and I don't know whether you have approached this or considered it. Over time, I've found out that many people's health problems come from their teeth. Now, you and I went to medical school. I think we probably had to memorize the teeth in anatomy class, but we had no education on dentistry and what dentistry is. Dentists, on the other hand, learn all about the mouth, but they don't learn anything about the rest of the body. So what I've learned through readings, Dr. Weston Price, Dr. Hal Huggins, and others, is that your mouth and your teeth and your dental hygiene is most important, the most important thing in maintaining good health. And I say this because any rancher knows this. When he goes to buy a cow or a horse, the first thing they look at is the mouth. They look at the teeth. If they have unhealthy dentures or gum disease, they don't buy them because they know that affects the whole body. Well, it does, and particularly one thing that is really causes a host of health problems is nerve roots, root canals. When they remove the nerve from a root, so you get a problem in your tooth that hurts, and doctor says we're going to do a root canal, which, by the way, is a multi-billion-dollar industry for dentists. But when you pull the nerve out of the tooth, it kills the tooth. The tooth's dead. Every tooth has about 3 miles of tubules in it. 3 miles in one tooth. That's just hard to imagine. And they say we're going to squirt something up there and we're going to sterilize it. Well, we know from studies that those teeth contain anaerobic bacteria. And when you have a tooth canal, those anaerobic bacteria are getting leached out into the blood, and they go to all the different organs in your body. I read a recent study where they took the plaques of the coronary arteries, and they cultured them out. And guess what they grew out? They grew out the anaerobic bacteria that exist in the mouth. So when you have and we recommend to all our guests, get rid of your root canals. I had one. You and I may have been at the same lectures. We've heard some lectures over the years on the dangers of root canals. Well, I went out about 8 years ago and I had one done because I had a bad tooth. And I said, well, I'm just going to get it done. And it still hurt, not as bad as it did. And then I went to another lecture at another conference where I heard a physician talking about the dangers of root canals. And when I had it removed and put a bridge in. Simple. So I don't want those bacteria leaking into my body, and they can cause cancer, they can cause liver disease, kidney disease, they can cause dementia, and commonly they cause inflammation in the coronary arteries, which leads to atherosclerosis and blockage of the arteries, which ultimately can lead to a heart attack. So what we recommend to our guests is see a biological dentist, not a regular dentist, a biological. Look it up under biological dentists. They understand the principles about oral hygiene, and they understand how it affects the entire body. I have friends of mine. I just had a buddy of mine call me up, and he said, he had some chest pain riding his bike, goes to the doctor, and they do a CT scan and say he's got blockage in his left anterior artery, and they're going to do a catheterization and check it out, and they put a stent in. And I asked him, I said, do you have any root canals? He said, yeah, I had another root canal put in last year. So I know that can cause a problem, and he needs to have that to cut down on any future inflammation. He's got to get rid of that. He's got to get rid of that tooth that had a tooth. And you don't put in a fake tooth in there. You put a bridge in. If you go back in and then you screw something back into their mouth, into your jaw, or into your upper maxilla, what's going to happen is that you're going to end up having the same problems. The same thing can happen with wisdom teeth. You get sockets down in there and bacteria breed. You may not hurt at all, but that bacteria breeds. And if you go look at teeth meridians, each tooth is tied to specific organs in the body. And so commonly, if somebody has a certain problem, you can look at the meridian and you can look back at the tooth, and sure enough, you'll find that the tooth that is sick is on the meridian of the diseased organ, and we never learned any of this in medical school, and the dentists don't learn any of this. So it's something, and I'm writing a book right now. I've finished it, but I've got to go back. It's being edited again. Now I've got to read through the edits, but I've written a book, John, entitled Health Span, Living Long, Living Well. And I have a chapter I did a deep dive on dental health. And we look at all our guests' teeth, and we ask them if do they have mercury amalgams? And mercury can cause inflammation in the coronary arteries and poison your whole body. when we talk about, have they had root canals, have they had wisdom teeth removed, and all these, what kind of gum problems do they have? Do they have recurring decay in their teeth? So we look at that, and then we refer them to biological dentists to help alleviate that problem. So I wanted to bring that to your attention. It's just, I've only got on this, I've known about this, and for years we've told people to get rid of their amalgams, but I was totally, really unaware to the degree that nerve root canal can cause serious disease, particularly coronary artery disease. Anyway, I was telling you about a friend of mine went to the doctor, and he's going to do a arteriogram on him. I said, Daryl, did he ask you about your teeth? No. Did he ask you if you'd had a root canal? No. They don't even think about it.
I think you're exactly right, Steve. Steve, we're running upon the end of our podcast. I know you've authored a couple books. Share with our listeners the books that you have available today, and I'm really interested and want to read HealthSpan when it comes out. But I know you have two other great books you've written. Tell us about those just briefly.
Well, I've got Hormones, Health, and Happiness, and that was my opus book back in 2005. I took a chapter out of that book on thyroid and wrote a thyroid book called Hypothyroidism, Health, and Happiness. And then I wrote another book called Do a 180, Taking Charge of Your Health, which explains the pharmaceutical and the medical industrial complex and how it's geared towards making money, not towards making you healthy. And by the way, I do completely support Robert Kennedy and what he's doing. And look, the guy's been fighting pharmaceutical companies for years. He knows the activity that they do. I like to call the pharmaceutical companies, they're drug cartels that have been legalized, and they pay huge amount of money to the politicians to be able to put their people on the FDA boards, and they approve all their various drugs. And the FDA then comes down hard on anybody like you or me or anybody like compounding pharmacies that produce anything that's natural. They come down on them like heavily. So do the medical boards. But Kennedy, I think, is going to get this squared away.
And Steve, if anyone is listening wants to get in touch with you and learn more about the Hotze Health and Wellness Center, how can they do that?
Well, I would encourage them, if anybody would like to get a copy of Hormones, Health, and Happiness, which talks about natural hormones and other modalities that we use here, you can call 281-698-8698, 281-698-8698, and I will send you a copy of this book free of charge. We'll send it to you. We won't charge you any delivery. Why? Because I want you to know something about your health. We believe in investing in the future and investing in people's lives. And you can read this, and then you can take it to your doctor, or you can find a doctor that practices in a similar vein. If you're up, you can go to see Dr. Wyckoff. I know him, and I highly recommend him. He and I have been allies in natural approaches to health for, has to be near, what is it? It's got to be 20, 35.
Almost 30 years, yes.
35 years.
Yeah, a long time. All right, Steve, thank you so very much, my friend, for being part of a Pathway to Wellness with Dr. Wyckoff. It's been a great podcast. You and I could probably fill a whole library full of podcasts. It would not be hard to do. But I appreciate you taking the time out of your day. God bless you for all that you do down in Katy, Texas, and I hope our paths cross again soon.
Thank you so much, Dr. Wyckoff, and God bless you and Cindy, your dear wife.
Take care. Well, that brings us to the end of another episode of Pathway to Wellness with Dr. John Wyckoff. If we can be of service, please look us up at wycoffwellness.com. Look for any of our other podcasts on whatever podcast channel you get to. We've got a number of them you can listen to. Or give us a call at 517-333-7270, 333-7270. Until we talk again and listen again, God bless you all.